Ladies and gentlemen, welcome to Global Health. I want to thank you again for making Global Health one of the top programs across Africa. Now, with AFROTURK AgroWorld TV as well being on stage, we are now broadcasting to more than 1 billion people in 49 countries, ladies and gentlemen. As the co-founder and managing partner of AFROTURK Agro TV and AFROTURK TV, also soon we're going to start our new TV channel, AFROTURK Health, which I'm so excited to announce now. So we are moving forward as a channel, bringing Africa and Türkiye together. And in this show, I promise you people from all walks of life. At the Global Health program today, I have my friend, which has been a good friend to me for more than 30 years, since my medical school. Professor Dr. Mevlüt Karataş. He is one of the top leaders in pulmonology. He is one of the top leaders who served not just Türkiye, around the globe, but especially our brothers and sisters in Somalia. In Somalia, in Mogadishu, there is a very important hospital. It's known as the Mogadishu Somali Türkiye Recep Tayyip Erdoğan Hospital. And he worked as the director recently, and he came from Somalia to our studios in Ankara. I'm so proud. I'm so excited to welcome him right now to this show, Global Health. Welcome, Professor Mevlüt. How are you today?
Welcome. How are you? Thank you very much. Thank you very much, Dr. Yavuz Selim. I am so happy to be here. I want to thank you your good invitation.
Thank you.
I really so happy to be here. Thank you.
We are so happy. I know how busy you are. You are in a very busy hospital, but I want to thank you for your leadership. What you're doing in Somalia, what you're doing in Turkey, all our viewers needs to know. I want to thank you on behalf of my entire crew here for being here with us. I know you very well. You're my friend since medical school, since 1990s. But for our viewers, tell me more about who Professor Dr. Mevlüt Karataş is. What excites Mevlüt? What motivates Mevlüt?
Okay. First, I was born in Konya in 1977, and I finished first school and college in Trabzon. Trabzon is city in northern part of the Turkey, and then the university in Cerrahpaşa Medical Faculty.
A very good school. Cerrahpaşa is a very good school.
One of the top medical faculty of Turkey. And I finished medical faculty in 2000.
Excellent.
And then I started residency in Süreyya Pasha Chest Diseases and Chest Surgery Education and Training Hospital. And then I worked as staff, pulmonary staff in Trabzon. And then I started Rize, Rize, another city in the northern part of the Turkey. There is a university in Rize, Recep Tayyip Erdoğan University.
Yes.
I started the Erdoğan Medical Faculty. I worked there 4 years. Then I came to Ankara. Then associated professor in Health Science University.
Amazing.
Now I have been working in Ankara in a hospital. It's called as Atatürk Sanatorium.
Yes. It's one of the most important chest disease hospitals.
Yes. This hospital opened at 1953.
Wow, very old one.
Yeah,
very important.
Very old one, and there are many experiences in this hospital. We are working with residency doctors.
Great.
This hospital, educational hospital also, and actually I am working on lung cancers, asthma, and now I am working in critical care unit.
Very good.
COPD disease and
Chronic obstructive pulmonary disease is one of the highest disease. Many people are smokers, unfortunately,
Yes.
and they end up with COPD.
And in Turkey, unfortunately, the smoking rate is high.
Yes.
And there are a lot of COPD patients. At the end of these diseases, we see the breath going down, and they need non-invasive mechanic ventilation and the other ventilation type. So I am now working in these patients in critical care unit, and we have actually 24 bad, critically bad, and I believe that we are doing good work because the mortality rate of our unit is very low,
Yes.
and we are caring with our patients, each patient
Yes.
closely.
That's very important.
Yes, some of them, actually, maybe all of them, elderly patients, over 60 or 70,
Yes.
and they have a smoking habit. It is very difficult to cut the smoking habits.
That's true.
You know, the smoking is the enemy of COPD. So
It's the enemy of humanity.
Yeah,
Smoking
yes.
is really horrible. I tell all my patients to stop smoking, decrease at least the smoking. It takes so much time to
Yeah.
convince them because they are addicted to it.
Yes, smoking is also related with the lung cancers,
Yes.
ovarian cancers, larynx cancers.
All types of cancers.
All them, actually, all types of cancers may be related with smoking. So it is very difficult to separate the patients from the smoking.
Yes.
So now I am happy because this channel. I want to thanks again.
Thank you.
I want to thank special to Dr. Sly
Thank you.
because, as you said, the beginning of the speech, we are friend from.
We're brothers.
We are brothers, and we are friend from maybe
30 years.
30 years. Yes, we started the same time the medical faculty, and when we look at the history of each other,
Yes.
we worked on a journal. It's called Paramedical.
Yes.
We
I'm so happy you mentioned paramedical. Yes, that's amazing.
If you want to give information about
You know better than me. I mean,
okay.
we work together, please.
Okay, we work together in Paramedical. Paramedical is a journal, is a medical journal, and this journal is made up with medical students.
Yes.
From
Almost 40 faculty, maybe.
Yeah.
12, 20 to 30.
Yes.
Then we increase up to 40,
Yes.
right? Lots of
Yes.
scientific advisory boards. It became a model.
Yes. Yes.
And at that time, as you remember, the prime minister was Necmettin Erbakan, and who is the teacher of our current president, Recep Tayyip Erdoğan. And he showed your work, my work as a model for our friends in other faculties, if you remember that.
Yes, in that point, may Allah rahmet to Professor Dr. Necmettin Erbakan.
Amin, inshallah.
As you know, he was the one of the prime minister of the Türkiye. He was actually the teacher for us, for you and for me and for our friends, for our brothers.
Entire humanity.
Yes.
And not just Turkey, entire Ummah.
Yes, he gave us a global vision, and we are working on this global vision now. I learned a lot of things about from Professor Dr. Necmettin Erbakan. May Allah rahmet Erbakan, inshallah.
Amin.
You are students of Erbakan, and I am students of Erbakan, and also now the president, Turkey president Recep Tayyip Erdoğan is also the
Student of
Prof.
Necmettin Erbakan. Yes.
Yes.
And especially what I remember is you did a very good job in Istanbul. You had Furkan Karabekmez, who also has been hosted in this show with us. And he became a top surgeon in aesthetic area. He served in Saudi Arabia. He served in many places. Also, there are many people in Istanbul that you worked at Cerrahpaşa.
Yes.
And, you know, when we look at what you have done and in your career, what do you think are the good things that motivated you? Because you could have been someone who just practice and do nothing socially. Because you're very active in Yeşilay, which is fighting against Green Crescent, which is fighting against smoking, alcohol, all bad habits, you know, cocaine, all of them. You are very integral and you worked there for many years. You also worked actively in many non-government organizations for the sake of Allah to help people. You know, you could have done only work as a doctor, but you chose, because of what Erbakan and Erdoğan has taught us, we should support our community. It's not just about making money. It is also helping people who need it. And you also connected as a leader Africa with Turkey, and that's the reason you are in this show. You served in Somalia without, you could have stayed in your room. But I know as a fact, in the hospital in Mogadishu, Somali, Türkiye, Recep Tayyip Erdoğan Hospital as a director, for 8 months, you worked, mashallah, tirelessly. And, you know, if you want, we can start talking about it. Or if you want, we can talk more about what you have done in Turkey first.
Yes.
I'll leave to you.
Maybe first Turkey and
Let's talk more
on
about.
Somali.
Yes.
Actually, you asked me what's your motivation.
Yes.
Yes. Actually, I have many motivation. I have worked as hospital director in Ankara, occupational and environmental hospital directors, and there is a region in Ankara, Mamak region.
Yes.
I established a hospital, Mamak Governmental Hospital, and I worked as a director in Mamak Governmental Hospital.
It's a tough neighborhood.
Yes.
Mamak is not easy. It's because there are many different levels of socioeconomic people, lower, mid, higher. So establishing a hospital and it's like starting a CEO, starting a new company. You're starting a new hospital. So I'm sure you have many stories as you're building it.
Yes.
The challenges, difficulties there.
I had many experiences during this time because I am I am a pulmonology doctor.
Yes.
But if you change your position to director, you have to challenge many factors.
You're a CEO now.
Yeah.
You're a CEO of a hospital,
But I had many experiences, and then I went to Somalia, Mogadishu. I visited many countries in all over the world, but I never go to Africa.
Yes.
Any country. We know there are 54 countries in Africa,
Yes.
but this is the first time. This was the first time for me.
So your
Not
first
achieve-
experience was Somalia in Africa.
Yes,
Wow.
first experience.
That's amazing.
I opened my eyes in Somalia.
This is
Mogadishu,
This is
first experience as a hospital director.
We will talk in our next
Okay.
episode about Somalia.
Okay.
I want to ask a couple more things before we enter the.
Sure.
What were the difficulties as you are in Turkey being trained, as you are building the hospital in Mamak
Yes.
or in other places? You establish also surgery rooms.
Yes.
I think you then carried your experience to Africa. But were there bureaucracy? Were there challenges? Were the difficulties? I don't want you to mention any names, but as a leader who is trained as a medical doctor, when you move from a doctor to a leadership position, what are the things? How do you need to? What should people do so they can actually manage better?
Yes.
What are your recommendations?
Okay. I want to give information about Mamak.
Yes, please.
Mamak region is the only region in Ankara didn't have any hospital.
It's a big population.
Yeah, big population. Yes, there is a big population, but there is no hospital. So there is a big pressure on health authority. We have to establish a new hospital, and the Mamak Hospital has now 300 patient bed.
Wow.
And
It's a big hospital. Yeah.
actually 25 intensive care unit bed, and birth rooms, and dialysis units, and emergency units, endoscopy units,
Wow.
and other special units this hospital contain. And what is the difficulties? As you know, we had education for
Medical.
medical. We are not engineer.
We're not.
We are not engineer. We are not a director.
We are not administrator.
We are not administrator.
Business oriented people.
We learned everything during this
On the job.
on the job. Yes, but if you have a good team, especially managers, the deputy managers, if you have a good team, you can go to success easily. Alhamdulillah, in Mamak period, we had a good team. good manager team, and we built it up 300 patient bed hospital.
That's amazing.
Now this hospital is working very hard. I think 1,000 people is coming in emergency service in one day.
Big demand. Very
Yes,
big demand.
1,000 per patient
Per day.
Yeah, per day. Yeah.
Just the
And
emergency.
yes,
You have the surgery, you have the internal medicine, all departments,
yeah.
endoscopy, all of them, right?
Only emergency.
On the emergency.
Only
1,000.
emergency. And maybe the 20 or 30 operation for one day in operation rooms, and the other parts is working on. So it is a first experience for me, the Mamak Hospital. I had this experience. Then I visited Somalia, but we are talking.
So establishing a hospital, you learned on the ground in a
Yes.
very difficult
Yes.
area,
Yes.
and then you upgraded to a more difficult area.
Yes.
So let's stop here, if you don't mind.
Okay.
Ladies and gentlemen, I will keep it very excited here. This is our first episode. In our next episode, we'll talk about Professor Dr. Mevlüt Karatash's amazing experience in Mogadishu at the Mogadishu, Somali, Türkiye, Recep Tayyip Erdoğan Hospital. Stay tuned to Global Health. This is Dr. Yavuz Serinsay. We'll be with you shortly. Take care and all the best. Bye.